experience. Joining me now is Dr. Marvin Borsand from the Body Sculpting Center. It's good to see you, Dr. Borsand.
Good morning.
We were mentioning now, we see advertisements, we see places everywhere, but we, when we're thinking about cosmetic surgery, should really go to a state-certified doctor. Explain why that is so important.
Well, what it is today, anybody could go to anybody's office, unfortunately, and they can just go ahead and have a procedure done, and there's really nobody observing that physician other than their license. But if you go to a state licensed facility, which means the state comes in, inspects the facility once a year or every other year, they come in unannounced, literally. So the license is really no different than what a hospital has. So for the consumer, you know, there is, in reality in life, you get what you pay for, unfortunately. And going to a state licensed facility, it usually is a little bit more costly because of having to have nurses, anesthetists, anesthesiologists, scrub techs, all people that are licensed. All these people are certified also by Advanced Cardiac Life Support. So if something doesn't go right, you have the right people there who have the right skills and can take care of whatever the issue is.
That's pretty important. I would agree with that. Absolutely. Yeah. Now, we're talking about breast augmentation, actually breast lifts, right?
Right. I wanted to cover today because there's a lot that's changed over the last 10 years. When we talk about breast lifts, you're really talking about taking, you know, mainly women that have either lost weight or have had children, you know, the involution changes that have occurred, and repositioning the breast with or without an implant.
Okay.
So today, when we look at what you'll be seeing on the screen there, here's a breast lift, and as you can see, this is a patient who had 3 children. There's significant changes, but after, the breasts are essentially off of the chest, and the only incision that she has is, it's almost like a lollipop, a circle and a line down. Madame Lejour was a physician that really developed this many years ago, but it's been modified to the point where we don't have to have this very large anchor incision anymore, and this has made a dramatic difference. So lifts are with or without implants.
Well, that's
today.
My next question. Let's look at the next picture too, because I've heard that a lift automatically means an implant. Is that true or not true?
No, not necessary at all. If somebody has a C or a D cup already, there's no real advantage in most of those cases with these newer techniques.
Is that what this is here? Or?
Yes, that's a person that we use just her breast tissue. That's all that's there in that picture.
Okay, and I think we have one more picture to look at too. Okay.
Now this person, as you can see, mainly has, it's a little difficult to tell, but only has loose skin. So if you really look carefully, she needs some more fullness, and she wanted a lot of upper pole fullness and roundness. And people can choose a very natural appearance. They can look something that's maybe a little rounder, much more youthful, and you can really adjust by the shape of the implant and the volume as well.
Okay, now we've got a new procedure that Dr. Borsand is getting very popular. I didn't even realize this was around until you mentioned it. Let's talk about this one.
Well, we're talking about gluteal implants, and today there's really 3 choices of making the buttocks look bigger. Either go and exercise tremendously, and hopefully there's enough muscle that you can increase it and then also gain weight at the same time. Or you can transfer fat from one part of the body to the other, and we do that pretty regularly today. And then the third, for people that don't have enough fat or really can't build the muscle, is using some type of an implant. And I brought a couple sizers along today, which are in blue, and these are, you know, the shape, and you can see that they're pretty flexible. And then this is the actual gluteal implant that we use, and it's very soft, and as they talk about putting the gummy bear new breast implant, it's essentially the same material.
I'm still sitting in shock thinking, who needs more of a bigger behind? What about the people who have a big one want it smaller? Is there anything to be done for that?
Oh, certainly liposuction. That's done pretty regularly. But on these, the advantage of, compared to when we were doing them about 10 years ago, the materials are much softer. So they either come round, and actually there's 5 different gluteal shapes that you have to think about. So it's really become much more sophisticated. So it's soft. It's really not very noticeable, and you put it in between, and I think there'll be a picture up here shortly of where we put it, and you can either place it on the left side of the screen between the muscle, or you can go above the muscle, and that's called subfascial. And recovery time's a little bit longer than breast implants, and certainly people have to stay off of them, but the results are really rewarding.
Well, that's what I was going to ask you. Can you do these at the same time?
You could, and probably wouldn't be done in many people at the same time,
I
just
see.
because of positioning. But it could be done, but I don't know that, I can't recall us doing the two at the same time.
Right, you're better off to do it once and have the
Separate
proper
stages.
recovery. Lots of information out there. Thank you, Dr. Borsand.
Oh, you're welcome.
And you have a
It's nice to
special
be.
offer for people watching right now, right?
We do, and thank you for bringing us. We had talked about for Channel 3 viewers for the first 50, what we would do is offer $500 off either procedure, a lift, or, and this is kind of the economic stimulus with Channel 3 and the Body Sculpting Center. So it'd be $500 off for the first 50 viewers that might contact us from your station.
Is that for both surgeries that you talked about
From
today?
either one.
From either one. All right. Thank you, Dr. Borsand.
Oh,
Good to
very
meet
good
you.
to-
Good to
yeah.
see you again,
Nice talking
actually,
to you.
and good information. And if you want more, of course, you can go online to bodynew.com. That's over at the Body Sculpting Center. There's the phone number right there on your screen, and you can give them a call.